you've been told by your doctor that you need an injection or you need surgery for your hip pain, watch this video first. Because in my 7 years of experience as a physical therapist, what I see in most people is not something that they need another procedure to help them fix. They actually need mobility and strength in their hip. In this video, I'm going to show you 3 exercises that you can start doing today to help with your hip pain. One of them being this one that I'm doing, but we'll get to that in just a moment. I had a lady come in recently who was having back pain and hip pain. She was pretty active. She was in her mid-60s. She was just really wondering why she was hurting so much every time that she walked. She felt it in the back of her hip. She had been to her doctor. She had been told that injections were the next step, but she just wasn't believing it, so she came to see me. After we talked for a little bit, I got her up on the table, checked her out, her motion, found out that she was lacking a lot of hip rotation and extension, and that was what was causing a lot of her pain. Because her hip couldn't move through the full range of motion that it was designed for, the tissues surrounding it couldn't accept the load that was being put on it, so it was causing a lot of pain. We ended up restoring a lot of her motion. That helped to fix a lot of her pain, and she went from a constant 8 out of 10 pain every time that she walked to a every now and then 2 out of 10 pain by the time that we finished up. The thing is that she didn't need a shot. She just needed her hip to move. Here's the thing that I see most people believe. My hip hurts, therefore it must be damaged, and because it's damaged, that means I need some kind of injection or some kind of surgery to fix it. It's not wrong in every case, but it is wrong in most cases that I see. What's actually happened is that your hip has lost its range of motion, and your body's compensation for that is what's causing the pain. Your hip pain doesn't need surgery to fix it. It needs strength and mobility in order to fix it. Here's the thing, the hip joint needs its full range of motion in order to properly distribute the load to all the surrounding tissues, including the glutes. When range of motion is limited, every step creates friction and overload in the areas that are trying to compensate, including in the buttock. So that pain that you feel in your buttock whenever you walk is your hip begging and asking for you to move it in more ranges than just frontwards and backwards. The worst thing that you can do with your hip pain is to stop moving, which I know sounds counterintuitive. If my hip hurts, I should stop doing it. But every time that you avoid movement, your hip loses a little bit more range of motion. Loss of range of motion means more compensation. More compensation equals more pain. More pain means more activity avoidance. You see how the pattern can go from here. All right, so let's now get into the nitty-gritty of it. Let's actually talk about these 3 exercises that I alluded to earlier in the video. You already saw one of them, and that is the hip 90-90 mobility drill. I'll demonstrate that for you here in just a second. The reason why that we want to do this exercise is because it helps to restore internal and external rotation, the ranges that are most limited in people with buttock pain whenever they walk. This is the range that your hip needs in order to distribute load properly. All right, so this first exercise we're talking about is the hip 90-90 position. What we're trying to do is we're trying to get into this, wherever you want to call it, mermaid sitting. One leg, the outside is on the floor, the inside is on the floor on the other leg, whichever one. We're just trying to get our hips into this 90-degree position. And it's called 90-90 because your hip is in a 90-degree position, your knee is in a 90-degree position. You can do this either on the floor if you can get down on the floor, or you can do this on your bed. Either way, you're able to get into a position is gonna work totally fine. What you wanna do is that if you're sitting on your bed, just like this, or cross-legged, you're basically crossing your legs. You're just taking the other leg and moving it out. So you can take one leg here, put it like this. You're gonna take your other leg and move it right here. So one position is probably gonna be easier for you than the other. For me, it's this. I have a little bit more struggle whenever I go the other direction. So to do that, you just move your legs to the other position like this. And what you're trying to do is you're trying to hold in both positions for a total of 60 seconds total. You can increase it as you get easier, or as it gets easier for you, by being able to bend forward into it, taking nice, slow, controlled, deep breaths while you're going through this, being able to go in all the different ranges of motion, leaning forward, leaning to the side, that kind of stuff. Okay, so exercise 2 is now going to be a glute bridge focusing on your hip motion. The reason why that we want to do this is because it strengthens the glute through the range of motion that we just restored with that hip 90-90 mobility drill. Mobility without strength doesn't stick, and this is what makes the change last. So that is going to look like, whether you're on the floor, on your bed, you're going to lay on your back and have your knees bent up. Just like this. Keep your hands on here on your stomach, down on the mat, down on the floor, whichever is easier for you. What you want to do is that you want to squeeze your glutes and lift your hips up. So it looks like this. We don't want to try to work where we're trying to use our back or our hamstrings to do this. This is mainly a glute exercise. As you lift your hips up, you should be squeezing your glutes. You should not be lifting with your back and then squeezing your glutes. Every single bit of this has to come from the hip motion. Starting off, you want to do this for a set of 8, and you want to do probably 2 sets of 8 to start off with. If you're really deconditioned, you may want to just start off with a set of 5. If a set of 8 is too easy, you can bump it up to a set of 10. What you want to try to shoot for is eventually getting to the point where you're doing 3 sets of 10, maybe even 3 sets of 12 body weight before you start adding any weight. Okay, and the third exercise that I want to talk about is an in-range hip flexion hold. The reason why that we want to do this one is because we never get into deep squat positions in our modern day life. But most of where our strength comes from in order to get up out of a chair or to get up off of the toilet is actually when our hip is bent in a 90-90 position and we need to try to get up out of that position. Because we don't do it this often, or we don't get into deep positions all that often, it doesn't get strengthened as much. This exercise helps to correct that and actually helps to address a lot of that back of the hip pain that we end up having. So from the bridge position, you want to be able to get into what we call long sitting. If you got to use your hands like I'm having to use back here to help support yourself, that's what you want to do. The idea is you're doing a straight leg raise. If you've been to physical therapy before, you know what a straight leg raise is, probably. If not, I'll explain it to you here. You want to keep your leg straight and you want to lift it up. That means you're going to have to tighten up your quad muscle, this big thigh muscle, to keep your leg all the way straight and lift it up. Now, because we are in a compromised position for your hip, we're at the very close to end range position of it. So you're not going to be able to lift it all the way up. Your toes are not going to touch your forehead. But the idea is to lift and to try to hold for a count of 2. It helps to alternate so that you don't get too tired, one leg versus the other. Eventually the goal is to hold it for a count of 5 seconds. Eventually getting to the point where you can hold it for a count of 10 seconds. This one is one that you don't want to do a ton of to start off with. You want to work your way up to doing 5 total, then going to 10 total, eventually getting to 15 total. Again, what this is doing is that this is working on our hip flexor right here to help us in these in ranges of motion so that we're also able to manage the pain in the back of our hip, but also be able to walk, to go up steps, to get up and out of a chair without hip pain. And that's ultimately what this exercise is doing. And it's strengthening things in a way that we're not strengthening in our day-to-day lives. So the woman that I told you about at the beginning of the video, she didn't need an injection or surgery. She needed a plan. She came in with hip pain and she was thinking she's never going to be able to travel again or be able to go back to exercising like she used to. She came in thinking that her hip was broken and she left with a plan. Not even 4 weeks after we started working on this stuff, and she's able to walk with very minimal pain and able to go back to doing all the things that she loved doing and is planning on a trip to Idaho in just a couple of weeks. It's not a miracle. It's what happens whenever you give your body exactly what it's asking for. The thing is that you're not too far gone. You're not broken. Just because that you have pain doesn't mean that something is broken. You don't need to have a surgeon to help fix all of the problems that you have with your body. You just need a plan. And now after watching this video, you have the first steps that you can start to take back control of your health, take control of your pain, and to get back to doing those things that you want to do. If this video helped, then you should subscribe, because I've got one video coming out per week where we talk about strength, mobility, endurance, all of that stuff, decreasing pain to try to keep you active and functional for the long haul. If you found this stuff very helpful, I'd appreciate that. If you want to see more content like this, I have a video right here that you might find very helpful or interesting. And I thank you guys so much for watching. I will see you all in the next video.